Malawi, a small country located in Southeast Africa, is known as the home heart of Africa. It has a beautiful culture exhibited by good and kind people, known for their accommodating moral values. People in Malawi live under the innate philosophy of Ubuntu, sometimes translated as, "I am because we are." Ubuntu points to one thing: every person is part of a larger significant world community. This encourages a land filled with golden hearts, community equality, and respect for all beliefs. The irony comes in when we talk of mental health, where this society warmth is not always reflected. The stigma of mental illness is universal. Across the world, people with mental illness are treated with less society value than others. In Malawi, this stigma exists because people do not understand what mental health is. Many people associate mental illness with witchcraft, severe psychosis, or drug and alcohol abuse. Stigma results in discrimination because people link mental illness with extreme negativity or bad and dangerous behaviors that can endanger other people. Imagine living in a country where people are very friendly to everyone but discriminate you, where you notice people acting ashamed, fearful, avoidant, or angry towards you. These society views and actions make people in Malawi afraid to talk about their mental health problems or find help. For example, depression is a common illness in Malawi. However, many people suffering from depression will not tell friends or family because they do not want to be judged or seen as weak. They also feel people will not understand that depression is an illness that needs treatment. This sadly forces people to live with their mental health problems untreated, making the problems worse. Like anywhere in the world, young people in Malawi face life challenges like school pressure, money or job worries, social media bullying, and relationship problems. These challenges can cause mental health problems like depression or anxiety. Sadly, some young people end up seeking comfort in the worst places possible, in drugs and risky behaviors to cope or relieve their mental distress. One reason is because there is little mental health support for young people in Malawi. The whole country has 4 known psychiatrists, 3 psychologists, and 3 mental hospitals. Very few schools now offer therapy to students, mostly through social workers or mental health nurses. The Malawi government needs to prioritize the mental health needs of Malawians from service provision, workforce, and education perspectives. Since January 2021, we have been talking to young people, local youth groups, and mental health advocates in Malawi about their mental health experiences and views. We also conducted a national survey with over 700 youth aged 16 to 30 years to measure mental health knowledge and attitudes. We have used data from these focus groups and survey to develop a mental health literacy education program. Our future plan is to implement this program as a mandatory course for students in Malawi universities to address the inadequate mental health support for the youth. The overall aim is to increase mental health knowledge and decrease stigmatizing attitudes while establishing youth-centered, accessible, and affordable education support. We hope that this will promote mental well-being of young people in Malawi, despite the country's limited mental health infrastructure and workforce.